For more than 40 years, Dr. Ed Whillock has worked to provide his patients with the best dental care available. By developing the world's most effective method of home mouth care, Dr. Whillock is proving that you can prevent tooth decay and gum disease by keeping your mouth free of disease-causing bacteria without excessive brushing and flossing.
The mission is to help people learn to prevent disease in their mouths. Most people don't realize that dental diseases are caused by bacteria living in their mouth rather than food particles. And when they brush their teeth and floss their teeth, they're removing some bacteria and food particles, but they don't realize that there are billions of bacteria that can be living down under their gums where traditional brushing and dental floss can't reach them. So we've discovered a method that we can take germ-killing agents like mouthwashes and get those germ-killing agents to go into the spaces between the gums and the teeth, and we can kill off those bacteria. It's a very easy thing to do, and the success that I'm seeing with it is much better than I saw in the 15 years that I taught people to brush and floss the traditional way.
Millions of Americans diligently brush and floss each day, trying to ward off the onset of tooth decay and gum disease. For years, the dental profession has preached these virtues regularly. But are these staples of oral hygiene really effective in preventing dental diseases? Studies show nearly 4 out of 5 adults in the U.S. have periodontal disease somewhere in their mouths, and there is mounting evidence that periodontal disease can contribute to the risk of heart disease, stroke, and diabetes.
These bacteria live in the spaces between the gum and the tooth, and when they cause inflammation, they get into the bloodstream, and they travel through the bloodstream. They can get into the heart and other parts of the body. Brushing and flossing are not as effective as we'd like to see because the dental floss can't get into the places where a lot of these bacteria live. In fact, it's impossible for the floss to get down into the areas where these bacteria live once the gum disease has started. We use a microscope to show people the bacteria that are living under their gums, and very often when a person sees those bacteria for the first time, they say, "Wow, that's living in my mouth. We got to do something to get rid of those things."
The good news is, there is a way to attack these bacteria before they attack you. A practicing dentist for over 40 years, Dr. Ed Whillock has discovered a little-known and effective method for killing and removing disease-causing bacteria from the mouth by combining the germ-killing effect of this special toothbrush with an antimicrobial mouthwash that reaches the spaces between the teeth and edge of the gum, where most disease-causing bacteria live.
We recommend the use of a brush that has a unique action where the bristles are able to twist their way into the little corners and crevices where the bacteria live between the teeth and under the edges of the gums. There isn't any other brush that I've been able to find in searching for more than 20 years that is capable of reaching into these special areas. This brush should not be used with toothpaste because the polishing crystals, the polishing grit in toothpaste gets into the fine gears on the head of this brush, and it creates so much friction the brush will stop working. Or if the toothpaste dries up in the brush won't work at all. We see people who have been doing it only once a day for 20 years and have not had a single cavity, have not had a single amount of periodontal disease or gum disease since they've been using this method. We'll see results with people using this method usually within a week or two.
Dr. Whillock's oral health system can result in a much healthier mouth and body.
I've been working with Dr. Whillock for about 1.5 years, and I have seen people who have had diseased mouths transform to a healthy mouth. Their mouth feels better, it looks better, and they're keeping their teeth. People don't think that it's possible, but once they do it and they actually get the hang of it, they're actually quite amazed at the results that they can achieve.
For the past 25 years, many people, including Dr. Whillock himself, have benefited from this very effective approach to mouth care.
Most of my life I've struggled with gum disease issues. Every time I've gone to the dentist, we do cleanings. My gums would bleed. They were always a problem. They were always sore, inflamed. And since I began the system in 2004, that's all cleared up, and I have no problems with that any longer. Dr. Whillock put me on the system in 2004 on my initial visit, and I began seeing results immediately. I would strongly recommend this system to anyone out there that would be willing to try it. You'll find that it's easy to use. It's a simple procedure. It doesn't take much time. It's once a day. It's clean, and it feels great.
I've been practicing dentistry for 43 years now, and over the course of those years I've been honored by being inducted into some special societies. When I was a dental student, I was inducted into Omicron Kappa Upsilon, which is an honorary dental society for exceptional dental students and for dental faculty. I've been inducted into the International College of Dentists and the Pierre Fauchard Academy. Those have been great honors and very gratifying. For me, the most gratifying part of my dental career is to see the outcome, see the results that people get from following this method of mouth care.
Initially, I thought Dr. Whillock's approach to battling the bacteria in the mouth was off the mark. It went against everything that I was ever taught in school about brushing and flossing. I do think that people find it hard to believe that they can just take a special brush with an antimicrobial agent and use that to clean their mouth once a day.
I came to Dr. Whillock because I had swelling on the left side of my mouth, and it was painful and bleeding, and Dr. Whillock found bacteria in my mouth and recommended to me that I use his antibacterial system for getting rid of the bacteria. I'm having just remarkable results. He did testing on the microscope, and within a week the bacteria was eliminated. The system was really easy to use. I didn't need to use dental floss, and I would highly recommend it to others.
When I first came to Dr. Whillock, he showed me all of the bacteria that was in my mouth. It was so disgusting. And now when I come for checkups, they can find hardly any, if not none. I feel better about myself. My mouth feels cleaner. I don't worry about gum disease, heart disease, and I would recommend this to anyone.
We look in their mouths, they don't have any cavities, they don't have any gum disease, and many people have gone for 20 years and more taking care of their mouth this way and haven't had a single cavity, haven't had any gum disease whatsoever, and they are very happy with the results they get.
In my case, I've been in construction my whole life. I've got big, strong hands, and I've had a difficult time manipulating floss through my gums. My fingers don't fit in my mouth very well, and I've gone to this system and I really don't have to floss any longer. That has been the biggest saving grace in this system.
We're very excited about the possibility of showing this system of mouth care to people at large. I've been helping people one person at a time for this number of years, but now it's time to show the world this method and how effective it is. Regardless of what the history of their mouth has been in the past with respect to gum disease, cavities, you can keep your mouth healthy, and it's simple to do, takes only a couple of minutes a day, just need to be thorough and consistent.
Contact Dr. Ed Whillock today and achieve your healthiest mouth.